Hello everyone. In this video, we will talk about all important drugs starting from alphabet C. So starting from the alphabet C, the first important drug is calcitonin. So we should write calcitonin. Calcitonin is actually a thyroid hormone which is produced by parafollicular cells of thyroid gland. Okay, this is peptide hormone which is produced by parafollicular cell of thyroid gland. Its important function is to decrease serum calcium and phosphate level. So the calcitonin, what do this hormone actually decrease bone resorption, and due to the decrease in bone resorption, this hormone lower serum calcium and phosphate level. So this decrease bone resorption. Okay, bone resorption. So the calcitonin results in decrease serum calcium plus decrease serum phosphate. What is the clinical uses of calcitonin? The calcitonin is used as nasal spray or subcutaneous injection, and its primarily uses the osteoporosis. Okay, so its clinical use is osteoporosis. It is also used in that condition in when bone resorption is increased. Okay, the conditions in which bone resorption is hyper extended or hyper increased is Paget disease and hypercalcemia. So it is also used in Paget disease and other hypercalcemia conditions. Okay, hypercalcemia conditions. This was all about calcitonin. The next drug is canagliflozin. Canagliflozin. The canagliflozin is inhibitor of sodium glucose cotransporter type 2, which is located in the renal tubules. So this drug causes the diuresis of sodium and glucose. So it is diuretic and it is beneficial in the patient of type 2 diabetes, and since it is diuretic, so it can be used in the heart failure, specifically diabetic patient. Okay, so the mechanism of action is the inhibition of sodium glucose cotransporter type 2 in the renal tubule, so that there is diuresis of sodium and glucose. Sodium glucose diuresis. Okay, and sodium glucose diuresis, so that we can use in the patient of type 2 diabetes. Plus it also used in the patient of heart failure. The other drugs which belongs to sodium glucose cotransporter inhibitor include dapagliflozin. So we can write here gliflozin is common suffix. So other is dapagliflozin and empagliflozin, and last but not least is ertagliflozin, which is not important. So canagliflozin, dapagliflozin, empagliflozin are very important drugs used in the treatment of type 2 diabetes and the heart failure. Next come captopril. So the third drug is captopril. The captopril is actually an antihypertensive drug which inhibit ACE enzyme, angiotensin converting enzyme inhibitor, and it is prototype of angiotensin converting enzyme inhibitor. So we can write here it is prototype, which is representative drug of antihypertensive class, inhibit ACE enzyme, angiotensin converting enzyme. So it is prototype and inhibitor of ACE, angiotensin converting enzyme, which convert angiotensin 1 into angiotensin 2, which stimulate aldosterone secretion, and it is used in the heart failure, and it is also used to decrease the incidence of diabetic nephropathy. okay, diabetic nephropathy, and it is used to lower blood pressure. So it is anti-hypertensive drug. So it is used in the hypertension, plus it is also used in heart failure. Okay, it also used in heart failure, plus it is used to reduce the incidence of diabetic nephropathy. Okay, the other drugs which belongs to this class include the benzapril, enalapril, lisinopril, quinapril. Okay, so we can write here just like benzapril, enalapril, okay, lisinopril, I think you are not visible by writing, and last is quinapril. Okay, so this was calcitonin, canagliflozin, and captopril. The ACE inhibitor have selective toxicity, that is, they causes hyperkalemia. They also contraindicated in pregnancy because they causes fetal renal damage and they cause cough due to increased concentration of bradykinin. Okay, bradykinin. So calcitonin, canagliflozin, and the third is captopril. Okay, after captopril, the next drug is the carbamazepine. Carbamazepine. I have a very long spelling. I have brought a very long spelling. Carbamazepine. The carbamazepine is an anti-seizure drug used to treat epilepsy and the seizure. The epilepsy is nothing but a recurrent seizure. Okay, the seizure which have recurrent tendency are called epilepsy. So the carbamazepine is anti-seizure drug. Anti-seizure drug. It is used to treat the tonic-clonic and partial seizure. What is the mechanism of action? In seizure, there is increased excitation in the CNS. So we have to decrease that abnormal excessive CNS excitation. So this drug block the sodium channel, in neurons. Okay, sodium channel in neurons. So it is used to decrease the excitation. And what are their clinical uses of carbamazepine? Carbamazepine is anti-seizure drug. It is used in the treatment of tonic-clonic seizure. Number one is tonic-clonic seizure. Plus it is also used for the treatment of partial seizure. Partial seizures. Number two is it is also used for the treatment of trigeminal neuralgia. It is also used for the treatment of bipolar disease, but it is backup drug. The main important drug is valproic acid. So it is the backup drug for bipolar disease, so that there is a it is used to reduce the mania phase in the bipolar disease. Okay, bipolar disease, I have wrote in wrong spelling. Okay, carbamazepine. What is their toxicity? The toxicity of carbamazepine include the CNS depression because it blocks sodium channels. It also causes myelotoxic. It causes damage to the bone marrow and also induce liver metabolizing enzyme teratogenicity. So what are their important toxicity? These include the hepatotoxicity. Okay, hepatotoxicity, also teratogen, and it causes excessive CNS depression. And this drug causes a lot of toxic effect to bone marrow, causes myelotoxicity. Okay, so these are the side effects of carbamazepine. Next come the servidilol. Okay, servidilol and servidilol and the labetalol. Okay, they have similar properties, so we will cover both of these drugs, servidilol and labetalol. The servidilol and labetalol both are adrenoceptor blockers. They block adreno receptor blockers. Okay, specifically both alpha and beta blocker. Both alpha and beta blocker, salmeterol. Okay, they are used in the treatment of hypertension and heart failure. So their clinical uses is hypertension plus heart failure, but their toxicity is cardiovascular depression, CVS depression, and this drug when taken in large dose causes asthma. Okay, so this was all about important drugs starting from C alphabet. We have covered only 5 drugs: calcitonin, canagliflozin, captopril, carbamazepine, and salmeterol. In the incoming videos, we will cover other important drugs starting from C alphabet. So please subscribe our channel and stay tuned.